Okay, let's continue. Okay, we already discussed the blood cells, the structure and function of the blood cells. Okay, erythrocytes, how they produce in bone marrow, okay, and the structure of them and then function of erythrocyte uh, and leukocytes. Now, the second step of hematology is to examine the cells either under microscope or some measurement of some chemicals. Now, as you see here, uh, examine leukocytes is the one uh, laboratory test that we routinely doing, most common hematological test, and um, we have to follow the feature of the leukocytes, the morphology of the leukocytes, such as um, let's see here, okay, the nuclear chromatin pattern, uh, nuclear shape, size and number of the nucleoli when present, okay, and cytoplasmic inclusions and nuclear cytoplasmic ratio. These are the features of the leukocytes we have to consider, okay, whether they are in normal range or not, okay, in order to diagnose, okay, or to get differential diagnosis for some diseases. Now, let's get, okay, continue and then uh, talk about neutrophils. Neutrophils, as you know, most common type of the leukocytes, white blood cells. About 60% of the white blood cells are neutrophils, okay, and uh, they usually okay, lobular forms are relatively small part of the cells when we compare with other white blood cells, okay? And the nuclear chromatin is coarse and clumped and stained deep purple, okay, as we see in these pictures, okay? The abundant cytoplasm is colorless or faintly pink, okay? It also contains a large number of very small and often uh, indiscrete lilac specific neutrophilic granules. Okay, there are in the cytoplasma. There are very small, a large number. Okay, lilac specific neutrophilic granules. Okay, and they contain some enzymes. Okay, in order um, to kill bacteria. Okay, now the other type of the leukocyte that we have to consider is band neutrophils. Okay, a kind of neutrophils. Okay, however, these are a young neutrophils. Okay, that it's indicate that neutrophils are producing. Okay, uh, are producing um, uh, uh, um, quickly, okay, and that means, okay, the band neutrophil is a younger form of the neutrophils, okay, and as you see, okay, the structure, the structure of the nucleus, okay, since they are uh, okay, attached to each other, uh, okay, and the shape of the nucleus is distinct for band neutrophils, okay, and an increase in their number is significant because it indicates the bacterial infections. It indicates that the number of the neutrophils rises, okay, and therefore, one okay, whenever we examine neutrophils, we are going to um, take a look and see whether the number of the neutrophils is changed, okay, and whether there are a band neutrophils or not, okay, is important. Now, neutrophil, how we count the neutrophils, okay? I mean, there are two methods, manually and automatic methods, okay, which done by instruments, but manually, okay, we we can also count the neutrophils, okay. Uh, an increased white blood cell count is known leukocytosis, okay, uh, and uh, which result from an increase in the absolute number of the neutrophils present in the blood. Since the portion, okay, the ratio of the neutrophils are the highest, about 60%. What does means the increased white blood cells counts almost means the increased number of the neutrophils. And therefore, we also call neutrophilia, okay? Leukocytosis, okay, a general name that we are using in case of increased white blood cells, okay? However, you also can say neutrophilia. Okay, it is usually neutrophilia is usually is accompanied by a shift to the left. Okay, what does shift to the left means? I told you before. Okay, if you have a younger cells, okay, uh, or in the peripheral blood, uh, or the cells that's supposed to be present in the bone marrow, and in some cases you see these cells in the peripheral blood circulation, okay, which we call shift to the left, okay. That means there is a increasing production of the white blood cells, okay. Neutropenia is a decrease in the absolute neutrophil count, okay. In some cases, okay, if patient is under chemotherapy or under uh, cortisol therapy, they may decrease the number of the neutrophils, okay? Also, some HIV also decrease the number of the neutrophils, okay, which is not good, right? Because these are our defense cells, okay? They fight with fight against microbes in order to uh, to maintain uh, our health in a good conditions. Okay, now eosinophils, okay, are the other type of the white blood cells, okay, slightly larger than neutrophils, as we see here, usually with a bilobed nucleus, okay, not a multi-lobed. They are usually bilobed, two lobes. Okay, cytoplasm is usually colorless but crowded with spherical acidophilic granules. Okay, which stain red orange. Okay, there are many acidophilic granules. Okay, eosinophilia, um, uh, an increase in the number of the eosinophils is known as eosinophilia. Okay, is associated with a wide variety of conditions such as allergic conditions, drug reactions. Okay, and eosino, eosinopenia or decreased number of eosinophils is seen with hyperadrenalism. High level of the cortisol will decrease the number of the eosinophil predominantly. Now, basophils, okay, okay, their nuclei usually occupy a greater portion of the cells. Okay, that means the cytoplasma nuclei ratio is changed here. Okay, irregularly shaped, it has irregularly shaped nucleus. And cytoplasma is colorless. It contains a number of deeply stained, coarse, round, and angular basophilic granules. Okay, and okay, the tissue basophils, also they call mast cells, are similar but not identical to the basophilic granulocytes. Okay, and basophilia means an increase in the number of the basophils. Okay, and usually we see such condition in chronic myeloid leukemia. Okay, monocytes, as you see here, are motile phagocytic cells, but they do not die after they engage in phagocytic activity. After they engulf the bacteria or viruses, okay, they will they will degrade them with the enzymes, okay, and the largest of the normal leukocytes are monocytes, okay. Nucleus is large and usually, as you see, indented, okay, and gray blue cytoplasm with extremely fine and abundant azurophilic granules, okay, included in the cytoplasma. Okay, the function and the structure of each type of leukocytes are different from each others. Okay, we have to know the structure and the function of the white blood cells. Okay, neutrophils, eosinophils, basophils, monocytes. Okay. Now, lymphocytes, okay, a kind of the white blood cells, okay, and it's we know that lymph nodes are located all along the lymphatic vessels in our entire body, okay, and lymph nodes include the lymphocytes. As you see here, all these are lymph nodes, okay, axillary lymph nodes, okay. Here we have okay, lymph vessels, okay, all these are lymph nodes, and they include lymphocytes, okay, in order to defend our body, okay, uh, from the foreign uh, organisms, microorganisms, okay. Okay, functionally, there are two types of the lymphocytes, as I mentioned before. These are T lymphocytes and B lymphocytes. Okay, T lymphocytes, as the name implies, they arise in the thymus, okay, from the precursors, and B lymphocytes are derived from hematopoietic stem cells in the bone marrow, okay, and their function also distinct for each of them. Okay, now pay attention. I have a question for you guys. Okay, now you see here the B lymphocytes. Okay, uh, okay, uh, B lymphocytes they differentiate to the either plasma cells or memory cells. Okay, when the B lymphocytes encounter with microorganism, okay, then some of B lymphocytes, they differentiate to the plasma cells to produce antibodies. Some of them differentiate to memory cells, and they live for a long time as a memory of human immune system. When second time the same microorganism enter into the body, these memory cells will um, um, identify them, okay, uh, and then they will produce anticore in a short time, okay. Therefore, okay, and lymphocytes acts to direct to the immune response system of the body, okay. B cells differentiation result in either plasma cells to produce anticorps or memory cells to identify the microorganism when they enter into the body second times. Okay, okay, lymphocytes, okay, among the white blood cells, about 30% of the white blood cells are lymphocytes, okay? 60% neutrophil, 30% lymphocytes, okay? 10% the rest of the white blood cells, okay? And after antigenic stimulation, the small lymphocytes can undergo transformation and are then called reactive lymphocytes. Therefore, during the examination, okay, we also need to consider whether there are a reactive lymphocytes or not. Okay, or these type of lymphocytes, also known atypical or variant or reticular lymphocytes. Okay, all these names are for reactive lymphocytes. Okay, which tell us that uh, something is wrong in our body. There are some microorganisms and lymphocytes already they already aware of them, okay, and they started uh, to um, um, production of the cells, okay, to increase the number of the lymphocytes. Okay, lymphocytosis, which means the increases number of the lymphocytes, okay, associated with viral infections predominantly. Okay, keep in mind during a bacterial infection, okay, the neutrophils, okay, the other type of the white blood cell increase. Also, lymphocytes also increase. However, the ratio of the neutrophil is higher, okay, in the bacterial infection. Okay, what does means in the bacterial infection predominantly we see the increasing of the neutrophil. Okay, in the viral infections predominantly the lymphocytes increases. Okay. Now, as I said, the differentiation of the B cells result into either plasma cells, okay, into plasma cells and memory cells, okay, both of them, okay. Plasma cells, okay, um, is rarely seen in the peripheral bloods, okay. They are large with a round and oval nucleus that is usually in an eccentric position, okay, as you see, okay, they are not centric, right? And now the cytoplasm is strongly basophilic, and the main function of the plasma cells is to produce antibody, immunoglobulins, okay? There are, different type of antibodies, immunoglobulin A, right? Immunoglobulin E, immunoglobulin G, right? And it's also, it based on the type of the microbe, okay, which kind of the immunoglobulin should produce by plasma cells. Now, okay, in order to reporting the leukocyte results, okay, we have to report the total count of the white blood cells and the relative count of them. Okay, the total leukocytes in the circulating blood vary by age. Okay, and then they can fluctuate with a circadian rhythm. Okay, if you measure the total number of the leukocytes in the morning time or the afternoon, they may differ from each other because it's the number of the leukocytes um, fluctuated with a circadian rhythms. Okay, and in the differential leukocyte count, cells are identified with examining and counting 100 white blood cells in a systemic manner, okay, and with result reported in relative number of the percentage. Okay, you have to count 100 white blood cells, okay, and then give a percentage of the subtype of the white blood cells, okay, as a percentage. Okay, what does means now absolute count, okay, total count and absolute count. In order to report absolute count, you have to count 100 white blood cells, okay, and then um, give a absolute ratio of each white blood cells. Now, the absolute cell count by the cell type is obtained by multiplying the relative number of the white blood cells by a total white blood cells per liters. Okay. For example, if a patient's white blood cells count is uh, 7 points, okay, times 10 to 9 per liter, and the percentage of the neutrophils is 70, okay, in the leukocyte differential, okay, because which uh, this result which you obtain by counting 100 white blood cells, okay, and the relative neutrophil count is, okay, is 70%, okay. Now, uh, in order to calculate the absolute cell count, okay, you have to multiply the relative number of the white blood cells, okay, and by the total white blood cells count, okay. 70% of you count 100 white blood cells, and then okay, determine that there are 70% of these 100 is neutrophils, okay? Therefore, you are going to multiply 0.70, okay? Okay, here 0.70, right? And now this, okay, we with the total white blood cells, okay, and then you get the absolute cell count, okay, for neutrophils, okay. For each of them, let's say if you have count 30 lymphocytes, okay, that means you have 30% of the white blood cells is lymphocytes, then you are going to multiply 0.3 with these numbers, because this number is the total, okay, uh, here this is the relative number of the white blood cells which you obtain from the instruments, and then you get the absolute numbers. Okay, any questions so far? I know these all stuffs are new for you guys, okay, but when you decided to become a physician, okay, or laboratory medicine scientist, you have to be familiar with such stuffs. You are going to use them to diagnose a kind of diseases, okay, also to monitor them, okay, to monitor the effectiveness of your treatments. You have to count the white blood cells, okay, you have to consider the type of each white blood cells, okay, the okay the shape of them, okay, the the type of the granules, and so on. Okay, now if it's come to the thrombocytes, okay, the other name for thrombocytes is platelets, you know that, okay. We know platelets or thrombocytes produced in the bone marrow. Platelets are an essential part of the blood clotting mechanism, okay. They act as a plug around the opening of the bone and release factors necessary for blood clottings, okay. Okay, they accumulate around the opening of the bone. They also release some factors, okay, which are necessary for blood clot formation, okay? And platelets do not have a nucleus, as we see here, a small structure, okay? And they are not actual cells, okay? They are a portion of the cytoplasm pinched off from the megakaryocytes in the bone marrow and then released in the blood circulation, okay? I showed you before, okay? These are not actual cells, okay? They, they, are, they are a portion of the cytoplasma pinched off from the megakaryocytes. Okay, platelets are generally round or ovoid. Okay, all and they they are have a colorless and pale blue background. Okay, you will be familiar with each of them by the time. Okay, it is really to differentiate these kind of white blood cells and thrombocytes from each other in a short time. But if you work with the type of the blood cells, you will be familiar with them. Okay. Okay, now it is your turn, and send your responses to each of these questions. Okay. Go ahead. One more. Today I am going to expect your responses. Okay. Thank you. Let's see. Okay, lymphocytes are associated with viral infections, mainly, predominantly. Okay, it doesn't mean that in bacterial lymphocyte infection, lymphocyte does not increase. Okay, they also increase, but the ratio is too low. Okay, than neutrophils. Okay, good. Okay, now, which of the following cells produce immunoglobulins, antibodies? Neutrophils, plasma cells, basophils, T cells. Come on, guys. I'm not, I'm not gonna grade them, okay? No worry. Okay, see. Okay, plasma cells is the correct answers, okay? B cells, again, the differentiation of B cells result in plasma cells and memory cells, okay? And plasma cells produce immunoglobulins, antibodies, okay? T cells does not. Okay, thank you for participation, okay? Okay, now, next one. Which of the following cells are essential part of the blood clotting mechanism? Erythrocytes, lymphocytes, platelets, leukocytes. Easy peasy. One more. Thank you. Platelets is correct answer. Okay, good. Okay, which of the following cells act as a plaque around the opening of the wound and release factors necessary for blood clot formation? Almost the same question, right? And the answers is the same. Thank you. See, okay, platelets is correct answer. Okay. Okay. Now let's go ahead. I'm gonna give a break, maybe in 15 minutes for 5 minutes. Okay. Now we have some other stuff that we need to discuss today. Okay. Okay, we already discussed the structure and function of them. Okay, and then how we examine white blood cells, right? Uh, and now it is time to talk, okay, the clinical to talk about the clinical hematology procedures. Okay, the tests, other tests that we are performing in our daily work. Now, um, laboratory tests performed in the hematology laboratory, okay, include the followings, okay, counting the number and concentration of the cells, red blood cells, white blood cells, okay, and determining the relative distribution of various type of the cells. Okay, you count white blood cells, total white blood cells, but you also need to count the relative distribution of uh, the type of the blood cells, okay, white blood cells, such as neutrophils, okay, basophils, eosinophils, lymphocytes, okay, and we're also measuring the biochemical abnormalities of the bloods, okay. All these help us, okay, uh, help to the physicians to get a correct diagnosis. Now, the test basic to the evaluation and follow-up of the patients, okay, are we see here the most common, okay, test that we're performing is the complete blood count, which is also known CBC. I am sure you are familiar with that. Okay, CBC, the most common uh, laboratory test in the department of the hematology, clinical hematology. And complete blood counts include hemoglobin, hematocrit, red blood cells count with morphology, white blood cells count with differential, okay, uh, and platelet estimates. Okay, these all should be reported under CBC report, okay, and are really important. And some of them are, okay, we are doing them, okay, with the instruments, okay, and we also provide to the physicians some other parameters, which is now the red blood cell indices. Okay, these are mean corpuscular volume, MCV, mean corpuscular hemoglobin, uh, MCH, and mean corpuscular hemoglobin concentration, MCHC. Okay, these are also, there are several calculated parameters, but these are most important parameters that we are using, okay, in order to get a diagnosis and differential diagnosis of blood disease, okay, or to some other diseases also, okay, now. Okay, the anticoagulant that we are using for CBC is ADTA. Okay, this is a choice. Okay, for CBC, and also heparin is using for a anticoagulant purpose. Okay, and the mechanism of action of these anticoagulants is not the same. As you see, ADTA, um, which okay combine with calcium and remove calcium. That means calcium is essential for coagulation. Okay, if you remove calcium from the environment, and then you will inhibit coagulation, okay, which is our purpose, to inhibit the coagulation, okay. And heparin acts as an antithrombin, okay, also result in inhibition of the coagulation. Okay, you know the layer of the anticoagulant whole bloods, okay, plasma, right, and middle layer buffy coat, okay, and then bottom layer which include red blood cells, right? About 55% is cells and 45% is plasma. Okay, you have to consider the appearance of the specimens, hemolysis, whether there is hemolysis or not, okay, and also consider other parameters that we are not able to talk today. Okay, hemoglobin, okay, a test within the CBC, which we are measuring in the clinical laboratory. And the unit for measurement of hemoglobin is milligram per deciliter. There are different techniques that we using to measure hemoglobin concentration. As you see here, hemoglobin cyanide, okay, or automated hemoglobinometry are two methods that we using to measure hemoglobin concentration, okay? And specimen for that, for hemoglobin, should be anticoagulant whole bloods, okay? Point of care hemoglobin assay, as we mentioned, we discussed before, is also important and convenient for patients to measure hemoglobin near to the bed. Okay, hematocrit, okay, which also known packed cell volume, okay, is a microscopic observation of the volume of the packed red blood cells in a sample of whole bloods. Okay, you are going to withdraw blood, okay, and put in a hematocrit tubes, as you see here, hematocrit pipettes, okay, and then stand them, let them to stay standing, okay, for a while, okay, and once the cells precipitate, okay, and then you are going to measure, okay, the if the total blood level is 100, okay, and then you are going to measure, this is a graduated pipette, and you are going to see, okay, how many percentage you have as a plasma, okay, how many you have a red blood cells, okay. Hematocrit is a percentage of the red blood cells. In this case, as you see, is the hematocrit of these samples is 45%. Okay, if increases, it has a meaning. If also decreases, it has a different meanings. It's easier, cheaper method that we are using, but it tells us important things. Okay, counting the various cells found in the blood is a fundamental procedure in the hematology laboratory. Okay, hematocrit is one the test. Okay, measuring the hemoglobin concentration. Okay, measuring the hematocrit, the percentage of the red blood cells, and counting the blood cells is other tests that we are performing. Okay, in modern laboratory, in big size laboratory, most cells counts are performed with a automated equipments, as you see here. Okay, okay, electronic counting devices avoid human error, which is significant in manual cell count, and are statistically more accurate because of sampling. Okay, they always take the same amount of the sample, maybe a microliter level, and then they count them precisely and accurately. Okay, reticulocytes, okay, other type of the test in the CBC, okay, in frame of the CBC. As I told you, reticulocytes is the last type of the red blood cells in the bone marrow, the last stage of the production of the red blood cells. In some cases, we see a few reticulocytes in the peripheral bloods. Okay, okay, I'm going to give a break after these slides. Okay, high reticulocyte count is known reticulocytosis. Okay, is a clinical indication that the body is attempting to meet an increased need for red blood cells. Okay, what that means, if you have low level of low concentration of the red blood cells, and your bone marrow attempt to produce red blood cells, increase its production. Okay, increasing production result in releasing of some reticulocytes in blood circulation. Okay, as you see here. Okay, what does means? Okay, this is important. The clinical significance of the reticulocytes is that if you diagnose anemia, okay, it doesn't matter the cause of the anemia, and then you administered a appropriate treatment for that, and you have to follow, you have to monitor whether your treatment is effective or not. Okay, then you are going to uh, uh, request CBC, okay, with reticulocyte count. If the number of the reticulocytes increases, that means your treatment is effective. Your treatment stimulates the production of the red blood cells. Okay. Now let's give a 5-minute break